Alright, so we got some very big news for My Medical Nightmare viewers. We're working on a new doctor's appointment, and I've done a lot of research on this one. Going to keep the details of this close to the vest for the time being, because in the past I found out that when I had scheduled these appointments, apparently somebody had got out in front of me and tried to ruin any chances of me having an objective medical exam. And you can see all the details on what happened to me. I had a piece of bone break off the underside of my skull. I went around to many hospitals and medical practices around Birmingham, Alabama. The doctors, radiologists looked at these scans and they wrote out these reports saying I had no injuries in these pictures. I'm sitting there as a patient. I know otherwise. I had to go get my records. You can see many of them on my YouTube channel, My Medical Nightmare. Got over 15 hours video documentation on this. And as a patient, after viewing these CT, MRI, and X-rays, I found the truth about my injury that I knew was very serious. I almost died from this in 2019. I had a very serious head trauma, basilar bone breakage in the area of the occipital condyle, condylar canal, and possibly foramen magnum. Area became infected over about a year. So working on a new doctor's appointment, and I'm going to be wired up with hidden cameras, microphones, going to record every aspect of this visit, and we'll see what happens here. Are they going to repeat the same line of some of these other medical practices that I had experiences with? Or are they actually going to try and help me? Well, one way or another, I'm going to share this with you, and you'll be able to see what happens. One thing interesting about medical practices in the year 2022 in the United States of America, we have a major service problem. That is the relationship between patients and doctors. It's all gone lopsided. And the medical establishment, these doctors, hospitals, nurses, medical practices, they have way too much power and they make way too much money. Patients have slid down to the bottom of this scale in terms of priority. And you'll see what I'm talking about in this very call that you're about to hear. So I call the medical practice and I'm setting up the appointment. And I ask a very simple question: what is included with a doctor's visit? And this is a key question. And the receptionist in this medical practice, and I assume the doctors in here are probably making many millions of dollars a year. She cannot tell me, the prospective patient, what is included with the doctor's visit.
1. For all other appointments or prescription refills, press 2. For billing questions, this call may be monitored or recorded for quality assurance and training purposes. A representative will be right with you.
Visit. Good morning. This is Bianca speaking. How may I help you?
Yes, ma'am. Good morning. I'm interested in scheduling a doctor's appointment. I will be self-pay.
That's fine. I'll be more than happy to assist you. I just have to give you information that our clinics do see self-pay patients. The copay for a self-pay patient is $60. That's just for the visit. That doesn't include any lab work or any other necessary tests that might need to be run. But I can definitely get you scheduled for an appointment.
Okay. Hey, I have a question. Okay, so it's $60 for the visit. What's included with the visit?
That's something that I cannot really honestly answer. Typically for a new patient appointment, they would go over like your, past medical history.
Okay.
And they might do blood work, but the only or a sure way to know that you're just going to be like being introduced to the doctor. So nothing really, I would say, extenuous is going to happen.
Hey, I've got a question. So yeah, if they do blood work, that would be extra, I believe, right?
Yeah, that would be extra.
If I've got a medical condition, I bring in maybe some of my past imagery, such as MRIs or CT scans, X-rays. Could the doctor look over those with me for the cost of the visit?
I don't see any reason why they wouldn't be able to.
So yeah, for $60, I will be able to see a doctor, an MD, correct?
Right.